Today we are going to discuss an important communicable disease, that is dengue and dengue hemorrhagic fever. A dengue-like illness dates back to more than 200 years ago. In 1780, outbreaks were found in Asia, Africa, and North America. Viral etiology was established in 1940. Global pandemic in Southeast Asia after World War II occurred. So there were many epidemics and pandemics after World War II in Southeast Asia. Dengue virus are arboviruses capable of infecting humans and causing disease. Infections may be asymptomatic, means without any clinical signs and symptoms, or may lead to classical dengue fever, dengue hemorrhagic fever without shock, dengue hemorrhagic fever with shock. So, dengue virus infection that can be asymptomatic, means without clinical signs and symptoms, or symptomatic, means with clinical signs and symptoms. And the symptomatic dengue virus infection will lead to dengue fever or dengue fever syndrome, and the other uh, the it will lead to dengue hemorrhagic fever, and if there is a plasma leakage, it will lead to the dengue hemorrhagic fever without shock and dengue hemorrhagic fever with shock, that is known as dengue shock syndrome. So these are the two consequences of dengue hemorrhagic fever. Dengue fever is a self-limiting disease. Prevalence of Aedes aegypti and Aedes albopictus. These are the vectors. Together with the circulation of dengue virus of more than one type in any particular area tends to be associated with outbreaks of dengue hemorrhagic fever and dengue shock syndrome. It means that in any geographic area, if the vectors of dengue fever, those are Aedes aegypti and Aedes albopictus, are present along with more than one serotype of dengue viruses. There are 4 serotypes of dengue viruses. If more than one serotype along with vectors of dengue fever are present in any particular area, it will lead to outbreaks of dengue hemorrhagic fever or dengue shock syndrome. Dengue in recent years has become a major international public health concern. Over the past 3 decades, there has been dramatic global increase in the frequency of dengue fever, dengue hemorrhagic fever, dengue shock syndrome, and their epidemics and pandemics. So even in Pakistan, dengue fever is found uh, countrywide and important. The urban areas like Karachi and Lahore are affected by this disease. Dengue is found in tropical and subtropical regions around the world. It means tropical and subtropical regions, the regions which have average temperature, and that the dengue is mostly found in those geographic areas. It means the weather, the temperature, which is average one, not much cold, not much hot. In those geographic area, dengue disease is found, and predominantly in urban and semi-urban areas, but now the disease is spreading to the rural areas. Globally, 2.5 billion of the people are at risk of dengue disease. 50 million cases are occurring worldwide in a year, and from which 5 lakhs are suffering from dengue hemorrhagic fever, and from which 12,000 deaths are occurring due to the complication of dengue disease. The disease is now endemic in more than 100 countries in Africa, America, Eastern Mediterranean, Southeast Asia, and the Western Pacific. It is endemic. Endemic means the usual presence of the disease. The Southeast East Asia and the Western Pacific bear 70% of the global burden of the dengue disease. So 50 lakh cases of dengue hemorrhagic fever require admission in hospitals each year, and large proportion of those are children. 12,000 patient dies each year due to the complications. So the case fatality rate is 2.5%. And what is the definition of case fatality? It is the ratio of cases to the deaths. So without proper treatment, case fatality rate can exceed 20% in dengue disease, and with modern intensive supportive therapy, case fatality rate can be reduced to less than 1%. A rapid growth in urban populations predisposes many people in contact with this vector, especially in areas that are favorable for mosquito breeding. So due to increase and rapid population growth, urban population has increased, and in this way they have a much contact with this vector, and that's why the urban areas have more cases rather than the rural areas, because the urban areas have a household water storage facility where the solid waste disposal services are already inadequate. In Asian countries, the Aedes aegypti breed primarily in man-made containers like earthenware jars, metal drums for collection of water, concrete cisterns used for domestic water storage, water tanks of the home, discarded plastic food containers, automobile tires, and other items that collect rainwater. And those are mostly in the urban areas. So potential breeding sites can be flower pots, flower pot plates, hardened soil of potted plants, toilet track, roadside drain, scooper drain, roof gutter, tree holes, plant exits, aircon tray, the causative agent or the agent factors. Dengue virus is of genus Flavivirus, and it has four serotypes: dengue 1, dengue 2, dengue 3, and dengue 4. So infections with any one serotype confers confirms lifelong immunity to that virus serotype. All four serotypes are antigenically similar. The first infection probably sensitizes the patient, while the second infection with different serotypes appears to produce immunological catastrophe. Means in dengue disease, there is a double infection or two serotypes are infecting the person and producing the disease. The first infection probably sensitizes the patient, while the second infection with second serotype infection uh, appears to produce immunological catastrophe. Why? Because the second infection with other dengue serotype leads to complications, severe form of dengue hemorrhagic fever or dengue shock syndrome. So the pathogenesis of severe syndrome involves pre-existing dengue antibody. Second virus antibodies are formed within few days of dengue infection. Both non-neutralizing antibodies promote infections of higher number of mononuclear cells, those are MOS cells, and release the cytokines, vasoactive mediators, and procoagulant, leading to the disseminated intravascular coagulation that is known as ERC, and it is increasing the bleeding tendency in the patients of dengue disease, and it is mostly seen in hemorrhagic fever syndrome. So all four serotypes have been associated with epidemics of the dengue fever that can be with or without dengue hemorrhagic fever with varying degree of severity. The vector Aedes aegypti and Aedes albopictus, these two are the vectors of dengue disease, and the Aedes aegypti, it is also causing the chikungunya and yellow fever. So it is the Aedes aegypti vector is also the vector in yellow fever, in chikungunya, as well as in the dengue disease. And the Aedes aegypti and Aedes albopictus both have high vectorial competency for dengue virus. Aedes aegypti is highly domesticated, means it likes to live in homes, strongly anthrophilic, means it likes the blood of humans, nervous feeder, it means bites more than one host to complete one meal. So it completes its one blood meal by biting many people, and that's why this habit results in the generation of multiple cases or outbreaks and clustering of dengue diseases or cases, especially in the cities. One mosquito bite can cause the disease, and the Aedes albopictus, it is a partly invades peripheral areas of urban cities. It is aggressive feeder and completes its blood meal in one time and one person. So one blood meal of Aedes albopictus is mostly completed by sucking the blood of one person at a one time. So the cases are much less in comparison with Aedes aegypti. Aedes albopictus does not require a second blood meal for the completion of gonotropic cycle. There are characteristic features of the Aedes mosquito. One distinct physical feature, that is the black and white strips which are present on the body and on legs in comparison with Anopheles mosquito of malaria. It bites during daytime, but the Anopheles mosquito of malaria, it mostly bites at the night time. This mosquito lays its eggs in clean and stagnant water. Only the female Aedes mosquito feeds on the blood. Why? Because they need the protein found in blood to produce eggs to complete gonotropic cycle. Male mosquitoes feed only on plant nectar or plant juices. A female Aedes mosquito lay about 300 eggs during her lifespan of 14 to 21 days, and the life cycle of a Aedes mosquito from larva up to the adult, it is up to the about 1 week. Means it from the larva up to the adult, the time taken, it is about 1 week from larva up to the adult mosquito. And what is the uh, dengue disease cycle? The virus is injected into humans with with the female mosquito bite, and the is virus is present in salivary glands. The virus replicates in local lymph nodes and liver. The virus is then released from these tissues and spreads through the blood to infect white blood cells and other lymphatic tissues. The virus is then released from these tissues and circulates again into the blood. The mosquito sucks blood containing the virus by biting the infected humans. Then the virus replicates in the mosquito midgut, ovaries, and body. It then escapes into the body cavity and later infects the salivary glands. The virus replicates in the salivary glands, and when the mosquito bites another human, the cycle again continues. So this is the dengue fever life cycle of dengue disease and transmission of virus. So already we have discussed that the incubation period, one, the incubation period is in the humans, that is known as intrinsic incubation period, and it accounts from 4 to 7 days. And other one, that is the incubation period in the mosquito, and that is known as extrinsic incubation period, and that accounts from 10 to 14 days. So this is the incubation period or transmission of the dengue virus. First, the mosquito, that is taking the blood by biting viruses, and when it is infected, it bites a healthy person, it causing the disease. And then again the mosquito, this is the human one, So I'm repeating again that infected mosquito, uh, the human that is infected, the mosquito bites the infected humans and getting the virus, and then the extensive incubation period starts, and when it bites a healthy human, it transmits the virus into a healthy human, and the intrinsic incubation starts. And again, the mosquito bites this person, and again the extrinsic incubation here starts in the mosquito, and again the cycle goes on. So there are some environmental factors which are associated with dengue disease. The population of Aedes aegypti fluctuates with rainfall and water storage. The mosquito survives best between 16 and 30 degrees centigrade. It means it is present in an average temperature. It can survive in an average temperature, not too much hot weather, not too much cold weather, and the humidity of 60 to 80%. It breeds in the water containers in and around the houses. Being a domestic breeder, it is a endophagic, means it likes to live in the homes, and anthrophilic, and it likes the blood of humans. The failure of urban authorities to provide civil amenities and poor public health infrastructure raises the potential risk for vector to breed at high level. So, if there is a failure in the providing public health facilities to the communities, or civil amenities to the urban areas, it will increases the risk for vector to breed at high level, and it will lead to increased incidence and prevalence of dengue disease in that geographic area. The severity of the disease. The serotype sequence is important to determine the severity of disease. 2 to 4% of individuals develop severe disease. All the four serotypes can produce dengue hemorrhagic fever, but the sequence of dengue virus 1 and dengue 2 serotype have a major epidemics or outbreaks. The high-risk population includes infants, obese person, pregnant women, the person suffering from hemolytic diseases like thalassemia, glucose 6 phosphatase dehydrogenase deficiency, congenital heart disease, diabetes mellitus, patients suffering from hypertension, ischemic heart disease, chronic renal failure, and the patients of liver cirrhosis. The clinical manifestations of dengue syndrome. So dengue infections may be asymptomatic or may lead to classical dengue fever, dengue hemorrhagic fever without shock, and dengue hemorrhagic fever with shock. So the classical dengue fever, it is also known as breakbone fever. It is an acute, febrile, viral disease. All ages and both sexes are susceptible to dengue fever. Children usually have a milder disease than adults. The illness is characterized by an incubation period of 3 to 10 days. Onset is sudden with chills and high-grade fever. Temperature rises quickly as high as 104 degree Fahrenheit with relative bradycardia and hypotension. There is an intense headache, retroorbital pain and eye movement, reddened eye and photophobia, and intense muscles and joint pains in the patient. The other common symptoms include extreme weakness, anorexia, constipation, altered taste sensation, abdominal pain and tenderness, sore throats, and patient is suffering from general depression. The skin eruption appears in 80% of the cases, which lasts for 1 to 2 days. Diffuse maculopapular rash on third or fourth day, followed by desquamation, commonly present on the face, neck, and chest. Fever lasts 2 to 4 days, rarely more than 7 days. Recovery is usually complete in the classical dengue fever, and case fatality is very much low. So, maculopapular rash, skin rash, is present in the dengue fever, classical dengue fever. Dengue hemorrhagic fever, it is a more severe form caused by more than one dengue virus or more than one serotype of dengue viruses. So it is due to double infection with dengue viruses, more than one viruses. The first infection sensitizes the patient and the second appears to produce immunological catastrophe. There are four necessary criteria to label it the dengue hemorrhagic fever by World Health Organization. And what is that criteria? Number first, there will be fever or recent history of acute fever, hemorrhagic manifestations, low platelet count will be there, less than 1 lakh cubic millimeter, objective evidence of leaky capillaries, and that is being detected by elevated hematocrit level, low albumin or low serum protein level, and there can be a pleural or other effusions. And in dengue shock syndrome, the clinical case definition for dengue shock syndrome, the four criteria for dengue hemorrhagic fever, which is described by World Health Organization. In addition to those four, the other, uh, there is a evidence of circulatory failure manifested by rapid and weak pulse. There can be a hypotension, cold, clammy skin, and altered mental status. There can be a frank shock is direct evidence of it is a direct evidence of circulatory failure in that patient. The hemorrhagic manifestations will be there like skin hemorrhages, petechiae, purpura, ecchymosis, gingival bleeding, nasal bleeding, GIT bleeding, hematemesis, melena, hematuria, encephalitis, encephalopathy, seizures, confusion, and even patient will go into coma. And what is the clinical diagnosis of dengue hemorrhagic fever? Acute high-grade fever, continuous and lasting 2 to 7 days, and there will be hemorrhagic manifestations, and which is identified by positive tourniquet test. And what is positive tourniquet? When the blood pressure cuff is wrapped on the arm, the test is performed by inflating the cuff to a point midway between systolic and diastolic pressure for 5 minutes. In dengue hemorrhagic fever, the test usually gives a definitive positive when more than 20 petechi per 2.5 centimeters per square on the forearm is present. So the tourniquet test is positive when more than 20 petechi per 2.5 centimeters per square are present. Then it is known as positive tourniquet test. Along with, there can be purpura, ecchymosis, epistaxis, gum bleeding, hematemesis, and melena, and there can be enlargement of the liver in this patient. What is the lab diagnosis of dengue hemorrhagic fever? There will be thrombocytopenia, hemoconcentration, and hemoconcentration is being detected by elevated hematocrit level. There will be leukopenia. Virus isolation will be identified in cell culture. Detection of viral antigen and antibodies by rapid diagnostic test, that is RDT or ICT kits, and it is the confirmation that is being done by ELISA and PCR, polymerase chain reaction. So, virological diagnosis, virus isolation by serology, that is the ICT, and real-time PCR. This is the confirmative test of dengue disease. The treatment guidelines. No drug for dengue disease. There is no any specific medication protocol for the dengue disease. No specific treatment, no immunization is present for dengue fever. The treatment is purely symptomatic. Rest and fluid intake for adequate hydration is very much important. The first group, that is the classical dengue fever. In this patient, we will encourage oral intake of that is the oral rehydration solutions. We are suggesting the patient to take the fruit juices and other fluids containing electrolytes and sugar. Give antipyretics for high-grade fever every 6 hours. Tablet sponging if patient has high-grade fever. We are not giving this patient, especially the aspirin, brufen, or non-steroidal anti-inflammatory drugs, because these drugs increasing the bleeding tendency in the patients. In case of complications, the patient should be admitted to secondary care hospital. And in the management of dengue hemorrhagic fever without shock, in this patient may need to be admitted to a secondary health care center for close observation, obtain a reference hematocrit before fluid therapy. Means we have to examine the blood of that patient to see the hematocrit level, give only isotonic crystallite solutions 0.9% normal saline, Ringer's lactate, and that is containing mostly the minerals and salts. IV fluids are usually needed for only 24 to 48 hours. Reduce IV fluids gradually as the rate of plasma leakage decreases, and this is indicated by the urine output and intake of oral fluids by the patient. Blood glucose, renal profile, liver profile, and coagulation profile is indicated, and warning signs should be monitored by healthcare provider until the period of risk is over. And in the management of dengue hemorrhagic fever with shock, all these patients should be admitted to a hospital with access to intensive care facilities, and blood transfusion facility is available. There should be judicious IV fluid, and resuscitation is very much essential. Isotonic crystallite solutions should be given, and volume just sufficient to maintain an effective circulation during the period of plasma leakage. Plasma losses should be replaced immediately with isotonic crystallite solutions or by blood transfusion. In case of hypotensive shock, dextran solutions can be given to the patient. And what is the prevention and control measures of dengue fever? The prevention of mosquito bites, and the prevention of mosquito bites are being done by the prevention of mosquito bites, and that can be by insecticides coil and spray, insecticide impregnated bed nets, protective clothes, screened windows and doors, and the vector control measures that can be biological control, environmental control, and chemical control. So the biological control, that is also known as natural control, and it is the anti-larval, and it anti-larval is being done by use of a predator, that is a Gansia fish. It is larvivorous, means when this fish is present in the water, it eats the larvae which are present in the water. That's why it is also known as natural control of the vector. The environmental control, it includes filling of breeding sites, mostly the water that is present, especially in the time of rainy season when the huge water is present on many places of the uh, urban areas. The proper drainage system, the covering of water bodies. So the water management is very much important, in the prevention of dengue disease, the chemical control. And the chemical control is being done by anti-larval chemicals, for example, use of deltamethrin, pyrimethamine, and parasgreen, and use of hormones, insects growth regulator chemicals, that is the methoprin, and anti-adults, which is chemosterolants, or DDT, dichlorodiphenyl trichloroethane, or the use of benzene hexachloride BHC, or malathion. So these are the chemical control of the vector of dengue disease. So this is the larviciding, mostly done in the European countries, even in Pakistan. So this is the chemical control. Insecticidal residual spray, that is also known as IRS, in which the homes are sprayed against the vector of the dengue disease. Fogging and aerosoling is also being done in the urban areas, and even insecticide treated bed nets are used to protect the community from the bite of the vector, and some repellents are also present like mossball, mosquito or coils are present, even smoke, which is being used in rural areas, which is common repellent used uh, in the world. So we have to prevent the Aedes from breeding sites. So we have to remove all sources of stagnant water, and we spread the dengue prevention message to the community. That is the health education. Thank you.